Hello, everyone, and welcome back to the world's okayest physical therapist podcast. I am your host, Dr. H. Please don't forget to like, comment, subscribe, share, send this out to everyone that you know, as I am learning to navigate this Byzantine labyrinth that we call the American healthcare system. I'm trying to share my lessons learned with you so that way you can better navigate the healthcare system too. Now, also, before I forget, don't forget to take a look at the YouTube or the Rumble or the Teespring or the Patreon. Please consider joining as it really helps with these projects. Now, without further ado, let's get into the topic of today's podcast: strains versus sprains. What's the difference and how does PT help? Well, first, let's take a look at what they are. First, what are we talking about here? What is a sprain? What is a strain? Well, a sprain is going to be an injury to a ligament. So the P in sprain, think of it meaning to pull apart. It's trying to pull a joint apart. Ligaments connect bone to bone, and they often are seen in terms of injuries in the ankle, knees, and wrists. And it's usually caused by a twisting or sudden trauma. So in the knee, for example, you have the MCL, the LCL, the ACL, the PCL. What do they stand for? The medial collateral ligament, the lateral collateral ligament, the anterior cruciate ligament, and the posterior cruciate ligament. Right, so basically, wherever you have a large joint, you have ligaments there to help hold those bones together to provide you stability and to make sure that you have mobility. So that way, when you go to move, those ligaments hold the bones together and let you move as an entire structure. The most common sprains that I see, just in case you're wondering, are definitely going to be in the ankle and the knees. It's not as common that I see it in the wrist. But in the ankles, for example, there's a whole bunch, and you have someone who rolls their ankle, they usually end up spraining a ligament. And then in the knees, you definitely have a bunch of ligaments there that can get sprained or completely torn, which we'll get into what level of sprain that would be. For a strain, so it's a T, strain, it's an injury to a muscle or tendon. And why is it muscle or tendon? Well, the muscle ends up becoming a tendon, and that tendon is what connects to the bone. So, it's very common to see strains in hamstrings, calves, back muscles, and shoulders. If you ever watch soccer or basketball, you are really used to seeing a lot of either calf strains or hamstring strains. And for the calf strains, it's also really common in football. A lot of linemen will end up straining their calf or something like that, which has been the most common one that I've seen. And it's usually caused by overstretching, overuse, or a quick forceful movement. It's like if you imagine a person who is a lineman and they're trying to resist another, let's say it's a defensive lineman, and you have the offensive line trying to push through him, and he's trying to stop this guy for all he's worth by pushing up through his toes into his hips and then pushing this guy away, and he gets forcefully pushed back, and he ends up getting a quick strain on his calves. That's a really common mechanism of injury. So, sprain is for ligaments because it's trying to pull the joint apart, and a strain is a muscle or tendon because it's causing some tearing of the muscle. Now, that's how I remember it. It's not perfect. Strains having the idea of a tearing of the muscle is just the first thing that's a knee-jerk reaction to help me remember the two. But like we're about to get into here with the different injury grades and the symptoms that come with it, you'll see that tearing is what's going on across the board. So for a sprain, which is the ligament, a grade 1 sprain is a slight overstretching or a microscopic tear of ligament fibers. It usually leads to some mild swelling and some tenderness right around the area. If you're poking right around over top of where it feels sore, that would be the tenderness, right, that we'll be talking about. It doesn't lead to really any change in the congruency of the joint or the stability of the joint. And recovery is usually looking at anywhere from 1 to like 4 weeks at the worst. Usually it happens around the second week mark that things are starting to get really better. So, really low level here, right? Really low level grade sprain. Typically gets better on its own within 2 weeks. Now, why 2 weeks? Easy. Most of the time when it comes to the human body, you're looking at cycles of 14 days for healing. So if I had some sort of paper cut or some sort of scratch or some sort of bruise or something or sunburn or whatever, you're looking at 14 days because that's just, it tends to be the cycle at which your body heals. That's how long it takes for different cell types to show up, eat all the dead tissue, and then the new cells to come in to help facilitate reducing that inflammation and rebuilding that tissue into whatever it is that it needs to be, whether it be skin, muscle, whatever. So, a really good rule of thumb here is whenever you see grade 1, you should be thinking 1 to 2 weeks. For grade 2, which again, this is for sprains, this is for ligaments, that's a partial ligament tear. You're definitely going to have some swelling, you're going to have some bruising, and you're going to have some increased joint looseness. Whatever it is that the ligament was holding together is now going to not be as structurally sound. So if that's your knee, you're going to have a little bit of a feeling more of instability and it having more shakiness or just the inability to support your weight. There's going to be moderate pain and there's going to be difficulty putting weight through whatever that joint is. In recovery time, you're looking anywhere between 4 to 8 weeks. Now, this is also important to pause for a second and talk about ligaments because ligaments exist in a place where there's usually not a lot of blood flow, meaning that if you partially tear a ligament or you completely tear a ligament, there's not going to be as much blood flow to that area as there would be other places, just because by nature of where ligaments exist, there's not a lot of blood vessels running directly next to them, which means healing is going to take a little bit longer than it would other things, typically speaking. Now, some of the larger ligaments definitely exist like around the knee, and the knee's going to have a pretty good chance of getting a lot of blood flow to it, but like the further away you get from your trunk, the further away you get from the pelvis or the shoulders, the more healing time it usually takes, just because there's less blood flow to those areas, generally speaking. Grade 3 is a severe tear. This is a complete rupture of the ligament. There's going to be severe swelling, instability, and loss of whatever function that joint was supposed to have. It's not going to be the same joint. It's going to be significantly impaired. Usually this means that you're going to have surgery and bracing, if not both. And recovery is going to it's going to take usually over 4 months. And that's not including surgery, because if there is surgery, then you're going to have physical therapy afterward, and that physical therapist is going to follow whatever protocol is given to them in order to help get you better. So this is highly, highly variable. I can't think of a single person that I've seen that has had a complete tear, a grade 3 sprain of a ligament, and there wasn't surgery done. I know that there's a growing movement of we shouldn't do surgery unless we absolutely have to for these people for ligaments. Like there's even studies that they're starting to do at looking what happens if they don't do an ACL tear reconstruction, if they just introduce the person back to sport over time after PT. That's something they're looking into doing now, but most of the time if you have a complete tear of the ligament, a grade 3 sprain, you're looking at surgery. And again, you're looking at months of recovery after that. So, that is sprains with ligaments. Let's move on to strains with muscles and tendons. Grade 1, which is mild, again, overstretched muscle or a small tear, mild pain with movement, and tightness. This is a really telltale sign for me anyway when I see a patient. If they've said they overused something or they felt a pull or something, and I go and check it, it's usually tight. So, that's usually why I'm looking at tightness right away in my thing, which is like, well, yeah, of course it's probably tight. I never stretch. You're like, yes, but this might be a little bit more tight than the other one. Sometimes, not all the times, there's no strength loss whatsoever. It just gets tight because it's trying to protect itself. Most of the time, you're looking at some strength loss, which is what's noticeable. That's what the athlete or the person notices is, hey, I can't do the same thing I used to be able to do, or I'm having a harder time doing what I was doing, or hey, I'm just not as explosive as I was. And recovery usually takes anywhere between 1 to 4 weeks, just like with the grade 1 for the sprain. It kind of depends. The further away from the trunk, again, the longer it usually takes to heal. For grade 2, which is a moderate tear, you're looking at a partial tear of the muscle or tendon, sharp pain with use specifically, or weight bearing, swelling, bruising, and definitely see reduced strength. Sometimes you can see a dent in the muscle. So for example, if someone has a partially torn quad or something like that, you can see where that tear happened, and it's a visual deformation of the actual muscle belly, which is a telltale sign that something else has happened. A really good example is one guy that I was seeing for a while. He had a partial quad tear, and his quad looked significantly larger than his uninvolved quad. And that was because so much tearing had occurred that the muscle belly had actually retracted up and closer to the hip crease. And so look at this thing, his one of his quad muscles was like double the size that it was supposed to be, and it just turned out it was because it was a partial tear. Recovery is anywhere between 4 to 8 weeks, so 1 to 2 months. Sometimes it takes longer than that, but this is typically something that usually heals with physical therapy pretty well. Grade 3 is severe. It's a complete tear, just like the last one. It's sudden and intense at the time, and then after that, it's usually less painful. The reason being, there's nothing there. So when you go to move whatever joint it was that it used to attach to, it doesn't attach there. So moving it doesn't hurt because there's no tension being put under the muscle or the tendon. Though the telltale sign is definitely going to be significant weakness or the inability to even move that limb because of what was torn. A really common example for this is the bicep tendon. Bicep tendons are common, unfortunately, bicep tendon tears, grade 3 strains are common when it comes to the bicep, the long head of the bicep. And this leads to what's called the Popeye sign, which is the dudes who look like they have absolutely massive biceps, but it's actually because they've tore the muscle. And that's what makes the bicep look even taller. So what they usually do, at least nowadays, is they might go back in, if at all, and reattach the loose tendon to the bone. Sometimes they don't even do anything. They'll just leave it alone. The reason for this is historically they've tried to reattach the tendon exactly back where it was supposed to be, and the failure rate of those surgeries was so high they just determined that it wasn't worth doing anymore. So there are sometimes you'll have a grade 3 strain, and they'll just decide not to do anything, in this case like the bicep. But there's usually, with the tear of the bicep, there's a sudden loud pop. It's pretty painful. You go home and you ice it for a day or two, and the pain slowly comes down, and then you just need physical therapy in order to get better. And to exercise and strengthen the muscles that remain around that joint to stabilize it and in order to help you get back to the motions that you want to do. So for the bicep tear, the muscle that is usually focused on the most after that would be the anterior delt, because that's the only significant muscle left that's doing shoulder flexion, for example. And recovery for this usually takes months because, again, if they decide to go in and do any sort of surgery to reattach the muscle, then you're looking at quite a long time, depending on whatever protocol it is that is given to you as a PT to follow to get your patient back. And that can be months. It just can. A really good example is I was seeing a patient that had a glute med repair. And that was, I think, 4 months of physical therapy, but it's highly variable. It depends. Sometimes you'll have someone who will come in with one type of tear, and the surgeon will call for a protocol that's pretty aggressive. And other times you'll have someone, same surgery, different surgeon, much more restrictive protocol. It's very variable, and I get that that's frustrating for people because they'll come in and say, my friend had this surgery and they were done in X amount of time. Why is it taking longer? Well, every human being's body heals a little bit differently, maybe a little bit faster, maybe a little bit slower. And also sometimes the surgeon does something slightly different. And the way they chose to do the surgery can make things like take longer, make the healing process last longer. Just, it depends. It is highly variable. So physical therapy helps with both of these. For sprains and strains, you're basically looking at a simple progression, which is if it's a low-grade sprain or strain, you're trying to get the person back to functionality quick. You're trying to see where they're challenged. You're trying to assess where they're weak at or where they're tight at. And then you're trying to go in there and strengthen them and stretch them and get them right back to where they need to be. One thing to harp on too here real quick, with grade 2 sprains and strains, it's frustrating, right? Because that's such a huge range in which you could have a tear. You could have a 10% tear all the way to a 90% tear, and technically all of that is grade 2. And so that's also a reason why things are highly variable, and depending on what the physical therapist has been told, what the imaging is that they have, an MRI or whatever, or what your doctor has told them, it's going to completely change what they're trying to do. So when it comes to grade 2 sprains and strains, it's highly, highly variable what they're going to be doing with you in the gym. And grade 3 is a complete tear, and that's really going to come down to the protocol. So if they're going to do any sort of surgery, they're usually going to give you a protocol afterwards saying, here is how we expect you to progress week by week, and here's what the physical therapist should do with you. If they don't do any sort of surgery, then you could be looking at them still saying, hey, here's what we're expecting you to do week on week. Again, it's just so variable. But basically, the long story of it short is that the physical therapist, seeing you, knowing what you've had performed or what you haven't had performed, or knowing what grade strain or sprain you have, is going to be able to help you. One of the things that's really common for this is, at least from the patient perspective, is again that wanting to know when they can get back to doing whatever it is they're doing, and that's the challenging part. One thing I will add here that's kind of frustrating too is a lot of times when you're making a lot of really good progress with grade 2 or grade 3 sprains or strains, the tendency of the patient is to immediately go back to doing what they were doing as fast as humanly possible, and they re-aggravate that injury. So there is something to be said for here that slow is smooth and smooth becomes fast. Going slow and smooth and making sure that you're taking your time in PT, learning your exercises, doing them well, and then being patient with your physical therapist and in your progression will prevent the likelihood of re-injuring and overloading that tissue before you're ready. Yes, I am working on making things to sell on Teespring, stickers and mugs that say slow is smooth and smooth is fast. So keep your eye out for that. When should you get help? Well, if you think that you've had a sprain or a strain, a physical therapist is one of the best people to ask. If you're still in pain after several days and you realize that you can't walk on your leg, for example, or your ankle or your knee, or you can't move it normally, and you notice swelling and bruising or any sort of, like I said, visual difference between the muscles side to side, that's a pretty good sign that you should be going and talking to a medical professional, because something is going on there. Pain for days is usually a sign of a more significant strain or sprain, right? Meaning even grade 1, it's not like a little, ouch, I stepped on it wrong and now it hurts for 48 hours. It's like, oh, okay, now we're going on days or a week or 2 weeks. It's worth you getting it checked out. If you've had more than one injury to the same joint or the same leg, it's definitely worth checking out. Usually that's being driven by some sort of muscular imbalance or some sort of tightness that's causing you to overuse one leg or the other, one joint or the other. And if you want to safely return to sports, or even like recreational sports, or to life, or to hobbies, or to work, that's definitely something you can go and talk to physical therapy about, because physical therapy is interested in getting you back to what we call your previous level of function, which includes all of these things. The physical therapists, we're going to evaluate you and say, hey, yeah, I can definitely tell that you strained or sprained this or that. And then usually what that does is it gives the physical therapist the ability to, and while also knowing whatever strength limitations or range of motion limitations you have, to say, oh, okay, here's how I can tailor a program to get you back doing what you want to do. It also helps make a stronger justification that if you went and saw a physical therapist and they say, yeah, this is definitely a significant strain or sprain, you might want to go and talk to your doctor about imaging. You now have a second opinion, right? You have your physical therapist advocating in your corner for going and getting those things done. So, to sum it up, sprains affect ligaments, strains affect muscles and tendons. Both can be mild, moderate, or severe, and physical therapy is pretty good at helping with sprains and strains grade 1 and 2. If it's 3, they're pretty good at saying, hey, this looks like it's completely torn. You should go and get this looked at by a doctor and consider further steps if there are any. And then after that, after you have surgery or after whatever it is that you and your doctor come up with, that's where physical therapy excels once again, because they're there to help you get back to doing what you're doing. So if you had to have a Achilles repair, physical therapy is great for that. If you had to have an ACL repair, physical therapy is great for that. If you had to go in there and have something else done to repair a ligament or a muscle, and reattach that bone. That's where physical therapy really excels, is following those protocols and getting you back to doing the things that you love. So, thank you so much for tuning in to the World's Okayest Physical Therapist podcast. I hope this cleared things up. If it did, awesome. Please leave a review. Please, again, like, comment, subscribe, and share this with everyone that you know in order to help all of us get more educated. If there's a topic that you want me to cover, go ahead and drop that in the comments as well. Now, everybody stay healthy, stay fit, and stay awesome. And I will catch you all in the next podcast.